To transplant or not to transplant? 27-year-old curly with male pattern baldness. Harsh honesty appreciated. So, I'm 27 and baldness is creeping up on me. 3 questions. 1. Family history. Many bald uncles. Grandfather who had straight hair and bald by 25. One curly uncle, like me, who still has his hair at 60. My hairline thinning now. Can I realistically look forward to his hair life? 2. At 27, is it likely I'll lose much more? Don't want that wonky transplant situation where the hair behind it keeps growing. 3. How do curls play into it? Does that make it better or harder? I got an estimate 100 to 130 density in donor area.
Thank you for your question. You're 27 years old, you've been aware of your hairline receding, and you asked 3 basic questions. 1, you're asking about the predictability based on certain family members who have similar hair. One who started losing hair much younger, one who's kept their hair until they were a little bit older. The other question is about the progression and, of course, the question of the benefit of curly hair in this situation, and your concern about continuing to lose hair after getting transplantation. And clearly, you've had a consultation where you described having 100 to 130 hairs per square centimeter in terms of density in your donor area. So certainly you're doing the right thing by learning more about what your options are and the prospect of a hair transplant, given the concern about progression. And I think this is a very, very important point for you to keep in mind. A little bit of background about myself. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I performed hair transplant for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a non-surgical solution for male and female pattern hair loss that we developed based on technology we used for hair transplant surgery. So I'm going to give you some just guidance as to how I talk to people who are similar to yourself who come to our practice. So to begin with, you have to understand that at 27, to have a level of receding of your hair to the level that it's at is certainly a concern. And I think you want to think in the worst case scenario, not the best case scenario, in terms of predicting the progression. As a general rule in hair loss, there's a rule of decades. If you are in your 20s, only 20% of men have hair loss, while when you hit your 40s and 50s, you're going closer to 50% and beyond. So for you to have a family history where there is a younger person who developed hair loss at a younger age, chances are you've inherited some element of that genetics to have your hairline noticeably receding to the level it's at. So then it goes on to it begs the next question, which is, can you do a transplant, and can you feel confident that your transplant will be adequate for a certain length of time? Well, when I was in training back in the early 90s, I could tell you that it was rare for us to offer transplantation for men in their 20s. Why? Because if someone had such an early onset and was ready to have transplantation, we had limitations as to what we can offer a patient in terms of preventing progression. Now, in 1997, a drug called finasteride, came onto the market, and it helped people slow down their progression. The challenge is that finasteride only helps about 60% of men, and with current concerns about finasteride and the effect on long-term sexual side effects or sexual function, has caused a lot of men to not want to take the drug, or men who have taken the drug and felt they had side effects to stop taking the drug. Now, in our practice, someone like yourself coming in, the first thing we would do is we would recommend something called, in addition to educating you about finasteride, of course, we would offer something called hair regeneration. Hair regeneration is something we developed over the past several years, where we're using a material called platelet-rich plasma, which is derived from your own blood, and it's a concentration of the healing and growth factors for wound healing, and combine that with something called extracellular matrix. Basically, with this treatment, it's an injection treatment, we're able to stop progression, reactivate hair that's not growing, and stimulate thinning hairs to shed and then grow in thicker hairs. We've been able to help many people who come from all over the world, and many people, men in their 20s, who have been struggling with this limitation of hair transplant. And so even if you're considering a hair transplant, a solution to help you provide you with a more stable solution before you do a hair transplant would be something in our practice would be using hair regeneration. In terms of curly hair as well as your density, those are both advantages. Having curly hair means you're able to cover more scalp. Having good high density as you do means there's more hairs per square centimeter, therefore you'll have more hair to transplant. In your situation, I have typically advised someone to do the treatment, the hair regeneration treatment. We follow people every 3 months and we document and see how they do. And I would usually suggest waiting till after they're 30 to consider transplantation. I would tell you that majority of people who come to us, and this is for both men and women, who have thinning hair, after we do the hair regeneration treatment, they don't feel like they need a transplant. And in fact, with a lot of our patients, the level of volume and improvement we're able to achieve can actually exceed not just one but two transplants. Now, this may not apply to you, but I think that learning about an option to help you stabilize will at least help you handle one particular factor that remains unknown, and that is rate of progression and what would happen once you did a transplant. You have to understand that the donor area is a limited area. We have patients who without curly hair, but certainly have been who had transplantation started in their 20s. By the time they reached their mid to late 30s, they had lost their existing hair, and all they had were transplants, and they still looked like they didn't have much hair. And that's not a favorable outcome when you think of the expense and the surgical process that they went through. But unfortunately, they ran out of hair for transplantation long before their hair was actually sustainable. If you think of a scenario where a man comes in who's in his 40s, who's been slowly progressing, hair transplant is a much more viable option for them because they have a certain rate of progression that's been established, and their expectations of the type of transplant is also going to be different than a man in their 20s. So I recommend learn more about options like hair regeneration, continue gathering research and information, but think stabilization before you think transplantation. So I hope that was helpful. I wish you the best of luck. Thank you for your question.